Hello. To read X-ray chest very difficult sometimes, as because uh, sometimes chest X-ray appear as very difficult to interpret. So there are some point to keep your mind when you find nothing on looking X-ray. When you cannot see any obvious finding, look for the easily missed finding in X-ray. So what are the point to be easily missed in chest X-ray? Today's this video is on this point. What are the easily missed point on chest X-ray? The number one is cervical rib. Sometimes we encounter this on chest X-ray and easily we miss this finding. Number two, apical pneumothorax. Very small pneumothorax on the lung apex, usually on the one side, unilateral, and easily misdiagnosed, undiagnosed. Next, rib nose. Usually rib nose is due to coarctation of aorta. Azygous lobe. Sometimes we encounter this azygous lobe. Next, rib erosion. Rib erosion is due to malignancy. It may be lung malignancy or breast malignancy or malignant deposit from other side of the body. There may be rib fracture. Very difficult to appreciate on X-ray. Rib fracture. Retrocardiac cavity. In case of hiatus hernia. Retrocardiac cavity. Very small pleural effusion, that is called loculated or encysted pleural effusion. A small pneumothorax with very thin collapsed lung margin. Usually we find the pneumothorax with definitive collapsed margin, but sometimes it appears that the pneumothorax is very small and there is a hairline, mind it, the word is hairline lung margin. Very thin, very difficult to appreciate. A small pneumothorax is easily misdiagnosed, and some patient may have no clinical symptom in a small pneumothorax patient. Subcutaneous emphysema, very easily misdiagnosed, another one. Syndesmophyte in ankylosing spondylitis. Through the cardiac shadow, you have to look back or look into the vertebral body for syndesmophyte. As you know, in ankylosing spondylitis, the syndesmophyte are very fine, marginal, and symmetrical. The three words for syndesmophyte of ankylosing spondylitis are very fine syndesmophyte, which are marginal, bilateral, that is symmetrical. A small bulla, another point to be undiagnosed or missed on chest X-ray, that is a small bulla that appear as very small localized hypertranslucency, not very small. Air fluid level in area of lung, that is lung abscess. I can share my experience here. The last week I have encountered a X-ray chest having this finding, that is lung abscess with very small, poorly appreciated air fluid level below the right dome of diaphragm. Actually that patient was case of lung abscess. Absent breast shadow due to mastectomy. Unilateral breast shadow is missing, so this may be a case of mastectomy. Thickened trabeculae in ribs hemolytic anemia, very difficult to understand, very difficult to appreciate. Thickened trabecular ribs in case of hemolytic anemia. Most important, I think, the osteolytic lesion in clinical examination. This is a hot cake, I think. Osteolytic lesion on the chest X-ray, on a rib or vertebral body on chest X-ray. That could be due to multiple myeloma, hyperparathyroidism, or malignancy. These three differential diagnoses of osteolytic lesion very important. Okay, so this is all about the point that are easily misdiagnosed or easily missed on chest X-ray. So keep it in your mind when you read the chest X-ray. So thank you very much.